Hi all, I am Dr. Raja Krishnan, an assistant professor working in assessment of physiotherapy. In this series of the video, we are going to see what is anterior abdominal wall, what are the abdominal surgical incisions, and we already saw about these. What are the structures underlying the anterior abdominal wall? What are the muscles? What are the regions? What are the layers in the anterior abdomen? And how are we going to operate in this? Now we are going to see about what is the peritoneum. The peritoneum is a structure which divides the fascia, which divides the skin from the viscera, and the upper quadrant, the thoracic region from the abdominal cavity. And the blood supply, main blood supply to this anterior abdominal wall are these arteries, the intercostal arteries, the internal thoracic artery, musculophrenic artery, superior epigastric artery, inferior epigastric artery, deep circumflex iliac artery, superficial circumflex iliac artery. And the veins are superior epigastric vein, para-umbilical vein, inferior epigastric vein, and the inferior vena cava is the main thing where all the veins are going to drain in this inferior vena cava. And this inferior vena cava is going to take out the blood through this vein and it pours into the heart, particularly to the right atrium. Then the lymph nodes are the watershed lines, superficial inguinal nodes. These are the main lymph nodes which they are going to use in this thing. Then the main clinical importance of this abdominal wall is we are going to see about the abdominal viscera against gravity, expulsive acts like micturition, defecation, and parturition, forceful expiratory acts, the movements like flexion and rotation, anterior abdominal wall abnormalities like divertification of recti, hernia, tumor like desmoid and sarcoma, persistent viteola, intestinal duct, persistent orachis, compartment separation, tram flap reconstruction are the main things we are going to do surgeries in this anterior abdominal wall. Then the next one is there are some lines which separates in each and every compartment, like in this each and every sections of the body in the abdominal wall. We are going to give each and every single incisions like the paramedian incision, phalansteal incision, for even for the C-section, cesarean. It is called a C-section. It is done in the lower part of the umbilicus, and from there they are going to inside go inside the uterus, and they're going to take out the baby. It's the main thing we are going to see about the abdominal wall. What are the anatomy in the abdominal wall? Because we are going to see how the baby is going to take out, how the go, how the baby is, how the baby is going to come out by a C-section. Before 50, 60 years, the C-section is very complicated surgery because there are lakhs and lakhs of C-sections are done in these areas. And now, after this, we are changed that most of the surgeries for the postpartum is done for this C-section. Then after this, we are going to see there is an DT-based video in this abdominal wall, and there's a clinical presentation which is regarding which is likely to the abdominal wall. And after this, there's a main part how we are going to separate each and every surgery. There was a clinical experience of my own where I saw about the skin flaps, where I saw about how the incisions are made, how the anesthesias are given, how we are going to move out after this. What are the surgeries are going to done, and what are the diseases may happen in this, and what I have seen, and I'm going to discuss it with my mentees. We already seen this clinical importance of the abdominal wall. There is a diastasis recti. This is mentioned as divarication of recti. Diastasis recti is a clinical condition, and it is very important for this physio field. Thank you for listening to this series of the video. In the next upcoming videos, hope we will discuss more surgeries and more of the PT content of the surgeries. If you want any PT contents, you can comment in here and subscribe my channel. Thank you.